In the hospital pediatric care environment, the professional nurse will often have concerned parents in the room. This can be an advantage, or it can be a real pain and a danger to the child. Parents may be attentive and participative, resulting in good care for the child, or their parental care habits may not match up with the kind of quality care dictated by hospital policy or the tenets of good professional nursing care. Consider the following scenario. A nurse working in the pediatric wing of the neighborhood hospital has just finished her 6 p.m. rounds and is documenting her findings. During her rounds, she notices that Jimmy Smith, a 14-month-old post-surgical patient, is asleep in his crib, while his mother knits a blanket and his father watches television. The nurse also notices that the side rails on the crib are partially down.
I see you have the crib rails down. When they are up, it makes it harder to get the baby out of the crib. Okay. Well, I'm going to put the rail up for right now, and when you want the baby, you can put the rails down. Just make sure you always have them up, okay? Okay. All right.
Yeah.
Oh, let me check on my baby. I got it. She's okay. She's good, right? Okay. Good people.
At 6:30 p.m., the nurse documents the following in her normal shift documentation. At 6:45,
Someone come quick! My baby fell out of the crib. It's okay.
the child is quickly evaluated by the neighborhood hospital emergency response team. Orders are received to perform a series of x-rays, which fortunately all come up negative for injury. An incident report, of course, was filled out, and this is the second time a child has fallen out of a crib on this unit within the past 6 months. Did the nurse handle this correctly? The nurse should have made clear the importance of young Jimmy's safety over the need for their simple convenience.
The bed rails down to play with Jimmy at all times, but Jimmy just had surgery, and it's very imperative that you keep the side rails up for his safety and for hospital policy. And when you arrive home, although he's recovering, he still needs to have his all the rails up so he can.
Side rails on adult beds can be considered a restraint, but it's different with children in cribs. Babies move fast, and crib rails are an essential safety element. Following the appropriate teaching, the nurse should document that she informed the parents of this important safety measure. She should also document that their preference was to keep the rails down. She should also check in periodically to make sure mom and dad are keeping the rails up. Additional training on the unit might also be appropriate, since this was not the first time in the last few months that a baby has hit the floor. So remember, constantly monitor for safety and document completely. You can be sued and assume the liability is yours. Remember, CYA. This is Henry Weatherbottom III. No babies were harmed in the making of this video, and any resemblance to persons real or imagined is purely unreal and entirely imagined. If you're thinking about that, you really need to be studying for a test or something. Any instructors watching at this time should now mark your gradebook with an A.